I just resigned from my role as Chief Medical Officer at the CDC. We had reached a tipping point around the dismantling of public health in our country and the weaponization of the work that we do.
Several senior CDC leaders resigned after the White House fired CDC Director Susan Monarez.
She was not aligned with the president's mission to make America healthy again.
I have great fears that our nation is incredibly vulnerable now for public health threats.
The message it sends is that scientific integrity isn't as important as political expediency. This is a red flag.
Susan Monarez has a background in the federal government and health leadership. She was just sworn in at the end of July.
When Dr. Monarez joined the agency, we were excited to have scientific leadership that would lead us around rigorous and transparent efforts.
Just hours before CDC Director Monarez was removed, former acting CDC Director Richard Besser spoke with her.
She relayed a conversation she had had with Secretary Kennedy. He told her directly that he wanted her to fire her leadership team and that he wanted her to agree to approve any recommendations that came out of the newly constructed Advisory Committee on Immunization Practices. She said she would only approve recommendations that were based on the best science and best evidence. She was told to resign and she refused and said that she expected to be fired pretty soon.
There's a lot of trouble at CDC and it's going to require getting rid of some people over the long term.
Lawyers for Monarez said that she was fired for protecting the public over serving a political agenda.
If our scientific leader couldn't do what needed to be done, we were going to be ineffective. So Dimitri, Dan, and I decided that if Dr. Monarez was leaving CDC, we would too. And we needed to do this together to show the agency, to show the nation how concerned we were about this.
It's highly unusual to see this rapid transition of a CDC director. And really what it says is a message about scientific expertise being summarily dismissed when it's politically convenient.
Secretary Kennedy wrote an email to CDC employees on August 28th saying that reform does not diminish the CDC's mission, it strengthens it.
We need strong leadership that will go in there and that will be able to execute on President Trump's broad ambitions.
CDC is not a partisan agency. It's apolitical. It's a national health security agency that's looking out for the health of each and every person within our community without a political lens or bias.
I was optimistic when I took on that role that I could align with President Trump and Secretary Kennedy's initiatives and had read many of their materials. For me, the issue became when we couldn't stand behind scientific integrity and there was political interference. In my resignation letter, I talked about changes I was concerned about. That includes the proposed budget cuts and the reorganization, as I know that those will significantly worsen our nation's health.
CDC has been in a vulnerable position on a lot of these things because it never really did have a full authorizing piece of legislation that said this is what the CDC is and does. It's kind of grown by bits and pieces over the years, and so it's been very vulnerable to these kinds of budget and job cut attacks. A day after Monarez was let go, the White House selected Deputy Secretary of HHS Jim O'Neill to be the acting CDC director. O'Neill is currently the Deputy Secretary at HHS. He was also recently confirmed by the Senate.
The Centers of Disease Control and Prevention Director usually is a senior public health official who has significant scientific expertise, but also leadership expertise and political acumen.
He's a healthcare investor. He's not a doctor. He doesn't have medical training. RFK Jr. really trusts Jim O'Neill. He has been working with him since the transition. He's viewed as a true believer and a good soldier and someone who can do the bidding of both RFK Jr. and his MAHA agenda as well as President Trump's MAGA agenda.
I worry that Mr. O'Neill will move forward with the Secretary's public health agenda. And the Secretary's public health agenda is extremely detrimental to the health of people in America.
Secretary Kennedy and others in the Trump administration have voiced this strong desire to see CDC just focus on infectious disease and not do anything else. So no more gun violence, no more drowning, no more infant death, kind of focus and research that it's done for a number of years now.
There's a new case of the measles in Williams County.
The Hawaii Department of Health is investigating a confirmed travel-related case of Zika virus.
This is one of the most concerning times I've ever seen for health in America. We're seeing diseases come back that were well controlled. I think for us to get back to a point where the CDC is able to do its job, the administration is going to have to decide that that's what's important. I fear that's not going to happen until people lose their lives.
I think the solutions are for Congress to get involved. We need to ensure there's adequate resources for CDC. We need to stop terminations and bring back staff, ensure that there's enough boots on the ground in communities and local and state health departments, as well as at CDC, to protect the public. And we also have to ensure that there's a continued commitment and support for scientific integrity and data quality.
Republicans in general have been very critical of CDC since the pandemic, but we have seen with the turmoil in the last week, Senator Susan Collins from Maine and Senator Bill Cassidy from Louisiana voice concern about what's been happening.
One of the most important things that could happen going forward is looking at how we can depoliticize the CDC.
Kennedy is scheduled to testify before the Senate Finance Committee on September 4th. The meeting is about just the president's healthcare agenda, but Kennedy has been getting a lot of heat on what's going on at the CDC, and Democrats have already stated their intention to grill him about that.
Now, the greatest risk to public health is not the next pathogen. It's the erosion of trust that we're seeing in our communities for scientific expertise.